So we want to take a moment to welcome everybody to the Family Medicine Grand Rounds for today, July 21st. Your event code for CME credit is 202047, and the information is there for you to register, but please make sure that you do so before midnight tonight if you are interested in CME credit. And if you're having any issues with that, please reach out to me. Next slide. So we want to thank everybody ahead of time for making sure that your microphone is muted as we begin. Also, if you would remain attentive as Dr. Svec presents today, be engaged in the session, and also I will be putting in the chat box at the end here the evaluation link for you to complete the evaluation for our speaker. So if you can definitely help us out with that. Next slide. So this is the South Texas Regional Family Medicine Grand Rounds, and we are partnered with the South Central Area AHEC, and our mission statement is listed there. Next slide. For those of you who are interested in seeing the sessions that you've attended, if you are capturing that CME credit, you are able to look at your transcript. If you go to the CME office website, you can click on the link there to view your transcript. You can also use that to submit for AAFP credit, which is coming up in the next slide. So those who are interested in that credit, please make sure that you do contact the AAFP. This presentation is worth 1 credit. So if you need that, please be sure to take your transcript that you get and submit that for those credits. Next slide. So we do want to, this is a new slide that we haven't mentioned before, but we want to make sure that we do tell you that it is the goal of all of our FCM Grand Rounds presentations to address the following nationally established physician core competencies. So you can see those listed here, but if you have any questions specifically about any of those competencies, please feel free to reach out. Next slide. So Dr. Svec has no financial relationships with ineligible companies to disclose. And today he's going to be presenting to us exercise as medicine. So I will let him go ahead and begin his presentation.
All right. Hello, everyone. So I'm Dr. Svec. I work at UT Hill Country doing primary care and sports medicine. And this is kind of like a part of my series of Grand Rounds lectures that I'm doing. Last time was pre-participation exams. So now we're going to talk about physical activity promotion and exercise prescriptions and kind of all the things that go along with that. Objectives today. So we're going to first talk about physical inactivity and the correlation it has to, patients' health. We'll define exactly what an exercise prescription is, and then we'll explain some ways of how to integrate exercise medicine, physical activity promotion into patient care. So physical inactivity is kind of a big problem. So 46% of US adults don't meet the recommended amount of aerobic activity, and 24% of adults engage in no leisure time physical activity. And so this kind of becomes more obvious on this map, which breaks it down by country and the percent prevalence of physical inactivity in adults ages 18 and up. So, and as you can see there, the US is actually in the 30 to 39.9% range. So we're definitely not doing very well there. This one's from 2015, so sometimes the numbers might be a little different. Reasons that we care about the fact that so many people are physically inactive is it's linked to increased risk of many diseases. So heart disease, high blood pressure, high cholesterol, type 2 diabetes, osteoporosis. So just the inactivity alone can increase the risk that a patient develops those issues. And of course, there's always some other components, family, diet, those things, but physical activity is included. It's also linked to increased healthcare spending, and so because of those, the prevalence of those diseases increasing, they estimate that it cost the U.S. $75 billion in 2000, just in healthcare expenditures. And basically, the way they kind of calculated that economic burden was the amount spent for those diseases. So part of the issues with exercise or with physical inactivity is it's really not taught much through medical school or residencies. So you get very little education on how you can do physical activity promotion with patients. And then with the thing with physical activity promotion is there's a big behavioral health component to it too. So much like you're trying to get someone to stop smoking or stop drinking alcohol or doing other drugs, the stages of behavioral change become important there. So if things are added to the medical school curriculum or to a residency curriculum, then we need to include talking about stages of behavioral change. So there's a big push actually at the big, not the American College of Sports Medicine Conference, but the American Medical Society for Sports Medicine Conference this year. Exercise medicine was a big component. It was one of the research priorities. And so there was a whole pre-conference day dedicated to exercise medicine. So there's an initiative put out by ACSM, which is the other organization I mentioned, which is called Exercise Medicine. And I'll show y'all, since we're on Zoom, I can show websites pretty easily. So I'll show y'all that website later. But the way they define exercise is medicine as it's the combination of physical activity assessment and promotion to improve patient health. So where do we even start there? So first step is to kind of assess the patient's current physical activity level. Then you want to provide some brief advice and or write an exercise prescription if that's something you're comfortable with. And then refer your patient to physical activity resources, whether that's people, programs, websites, anything that could help them kind of know what to do. Because a lot of times if someone's inactive, they just don't even know where to start, where it's safe for them to start with their medical problems. And so that's why it's good for it to come from us. And we'll talk about each step a little more. So step one was to assess the physical activity level. So where do we even start from there? So these two questions are kind of where you want to start. So on average, how many days per week do you engage in moderate to vigorous physical activity? And vigorous physical activity, to me, I don't know that patients are gonna, understand. So I would give examples. So for example, brisk walking, bicycling, aerobic dance. And then on average, how many minutes do you engage in physical activity at this level? So that will give you the days per week and the minutes that they're active on those days. And that's becomes really important with the exercise prescription, because the exercise prescription is basically just kind of goal setting with the patient. And this lets you know like realistic goals you could set. There are actually some practices, and I think Kaiser is one of them, one of the Kaisers, where they have these questions built into their EMR, and they're just 2 questions that the MAs ask at rooming, in addition to their typical rooming. And then if there's time, those are things the physician can see and comment on. So and then you need to assess their readiness to change. And this is what I was mentioning before, where the stages of behavioral change are important. So there's 5 stages. Pre-contemplation. So that's basically a patient that's like, no, I'm just going to stay sedentary. Contemplation would be someone that tells you that they are interested in, or they've been thinking about, increasing their physical activity. Preparation is they've actually been making a plan to become more physically active. And then action is the patient's meeting their goal, but only for a short period of time. And then maintenance is they've been meeting it for over 6 months. So those are our 5 stages there. And then once we've assessed both those things, so this is where the next step was to either provide the brief advice and or exercise prescription. So these are made up of 4 components. And you should definitely adjust it for each patient. This is kind of what I was saying. Those other two questions become important here because you want to set realistic goals for your patients. So, because if you tell them, okay, you exercise 0 days a week, you should exercise 5 days a week. You're kind of setting them up for failure because it's hard to go from 0 to 5, and then they're going to feel like they aren't meeting their goal and they'll get discouraged. That's never a good thing. So, so that's kind of what I was talking about. And so you set realistic goals. So like I said, don't go from 0 to 5. And so, and then intensity is you want to base this on their prior physical activity and their medical history. So heart failure patients, you want to stay with light to moderate, because if they get too vigorous, that's dangerous for their heart health. And so I kind of have a chart that's going to guide us through this a little better later. And so, but once again, very patient specific. And the acronym for this is FIT. So it's frequency, intensity, time, and type. So, time. So you want to base it on their current physical activity level. Goal is 30 to 60 minutes per day, but sometimes that's too much too fast. So you may even want to start with like 15, 20 minute increments there. And then one thing that I always enforce to patients when they're sent to me for exercise prescriptions is that they can break that up into smaller chunks. So 30 may seem like daunting to them, but 15 and 15 is a little bit more doable. So do 15 minutes before work and 15 minutes after work. And that's doesn't seem as scary, especially if you're starting at 0. So, and a lot of times they do feel better knowing they could break it up, or they could even do 10, 10, and 10 if that's easier. So, and then type. So this is, probably the trickiest type, especially depending on where you're practicing at. Some patients have access to so many resources, they'll just buy whatever you tell them to buy. And some can be a little bit more resource limited. So in my history section, I always kind of first ask, like, well, what do you have at home? A lot of times patients tell me, oh, I have this treadmill and I don't use it. I have this stationary bike, but I don't use it. I have some weights, but I don't use it. And, those are things that you could use in your prescription, because that's things they already own, and you're not telling them to go out and buy things. If they, or they may have a gym membership that they don't use. So that's something that you can try to motivate them to start using too. The most affordable entry point I found is, of course, just like general walking, because most people can walk, depending on where they're at. And then resistance bands. They tend to be not too expensive, and you can actually get a pretty decent full body workout with resistance bands. So, and they're, on Amazon, they're at Target, Walmart, they're everywhere. So, and then, so this is just the, I kind of just typed something into Epic that basically goes over those 4 things: frequency, intensity, time, and type. And then I put it in big font at the top of their after visit summary. But if you wanted something that you could just check off and print out, this is from Exercises Medicine. There's all different types online if you look. And you could just check off, so days per week, intensity, time, type, and then if you want to set a step goal with them, which might be good. Because like it says down there, the ultimate goal of 7,000 to 9,000 steps per day. And then the other thing is the muscle strength training. So, and like it says down here, try elastic bands, do body weight exercises. So, there are things to do to not buy a lot. But yeah, you can print this off, check off the boxes you want, and then sign it and give it to them. And then, I would tell them, put this up somewhere in your house where you'll see it frequently. Kind of as a motivating factor. So, and the good part about Exercises Medicine is they have a Spanish version. So you do need a Spanish version that's already made. And then there are, with patients that do have chronic disease, there are some considerations you want to take into account. So depending on the severity of their heart failure, you may want a stress test to guide what sort of intensity you're going to recommend for them. Patients with fibromyalgia, a lot of times they do better with pool, is my experience. And then you always want to warn them that pain may temporarily increase, but then it should start getting better, especially with fibromyalgia patients. If you don't give them that warning, then it's not going to be a successful physical activity promotion visit. COPD, you just want them to avoid very hot or very cold environments, because that could kind of trigger the COPD to be worse than. And for type 2 diabetes, keep a glucose log. Definitely if you're on insulin, because they may need a snack before or after activity, because your glucose does improve with exercise. So and then you definitely want to counsel them in the long run that if they are consistent with their exercise, their insulin may decrease. So and that's mainly the insulin dependent type 2 diabetics. Those that are just on some of the more the beginning oral medications are less likely. So this is the chart I mentioned that kind of guides you. So hold on, my little bar is blocking the top. So participates in regular physical activity, yes or no. And so then you kind of go from there. So for example, if they don't participate in physical activity, they have no cardiovascular, metabolic, or renal disease, and they don't have symptoms of any of those, then they really don't need a medical clearance, and they can do light to moderate exercise. And then they can progress to vigorous. But on the other hand, if they participate in regular physical activity, or no, they don't, they have signs and symptoms suggestive of cardiovascular, metabolic, or renal disease, and then they do need medical clearance. But if they're seeing you, for the most part, you can provide that medical clearance. Unless you're not comfortable, then don't feel bad to include the specialist. And then if they get medical clearance from either you or their specialist, you want to start them with light to moderate, and you can progress as tolerated. So I feel like this, really breaks it down well for you about where patients should start. So, it's all on the slides. So, and let's go. And then if you want, other places you could refer to. So like I mentioned, don't be afraid to include specialists, cardiologists, pulmonologists, especially for heart and lung patients. Physical therapy, some patients are, scared of injuring themselves. And if they have a reason that they would qualify for physical therapy, that's probably not a bad place to start, because they can at least do a few sessions with them, kind of guide them on, proper form, technique, give them some personalized training programs to do at home, and then let them go. But just emphasize that, they aren't a personal trainer. The physical therapists are treating usually a chronic condition. And then kind of outside specialists, the top is more like things that might be available within your healthcare system, and the bottom is outside. So an exercise physiologist, personal trainer, group fitness instructor, but those are obviously going to probably be expenses for the patient. So you just have to have that discussion with your patient, how they feel. Okay. And then don't want to focus on it, but if you are doing this in the context of a visit, you probably do want to be able to bill for it. So there are a couple options here. So one, you can bill for time, because these can be a longer visit if you have time for a longer visit. The other part is just to include it as within the plan for another chronic condition such as hypertension or diabetes, because we know those things will improve with physical activity. So the fact that you counsel them on physical activity promotion does, line up with that chronic condition. Or you can do it during their annual physical if you have time. So, so there are ways to, make sure your efforts are billed. So these are some of our main points, and then I'll show some, I want to show you all some resources. So lack of physical activity can cause or worsen many of the non-communicable chronic diseases. Exercise prescriptions are an easy way to encourage a patient to increase physical activity. And, there are multiple resources available to help you. So let me show you one now. So we'll switch to here. So this is the, like that one. Okay, so this is the Exercises Medicine website, and it's just exercisesmedicine.org. And it's put out by the ACSM, which is it's a national organization. It's made up of primary care sports medicine, ortho sports medicine, athletic trainers, physical therapists. So it's multidisciplinary. So for us, we would do healthcare providers. So you click there, and then it kind of brings you into a lot of resources. So there's where do I start? How do I assess? So if there's anything that you want refreshing on that I talked about today, a lot of it is here. Does the patient need medical clearance? And this is where you can find that or find a more basic chart than the one I showed. And then here, where it says additional resources, definitely a really helpful place to go. So this is where the exercise prescription form comes from. Let's see, that's the one that I put in. And the Spanish version as well. You can also get a smaller version. It's like a half page instead of a full page. And then another really helpful area is this RX for Health patient handouts. So these they made, in conjunction with, multiple experts, it says research scientists and clinicians. And this is the section I like, exercise prescriptions for medical conditions. So even if you don't have time to do like a full, let's talk about everything during the visit, let's make a plan and let's go for all that. You can say like, where's type 2 diabetes? So you can go to type 2 diabetes, and this is something that you could print out and, include in the paperwork that you give after the visit. It's pretty nice. It goes through how to get started, your cautions that you have if you're a diabetic and you're starting to increase your physical activity. And then it breaks it down into aerobic activity and strength training. So you want to build up to 150 minutes a week for aerobic activity. And then strength training, not as much of a goal there, but 2 to 3 days a week. And then give some cautions there. These are kind of just more general cautions, except for the last one. So slowly increase how much you lift, avoid straining. But if they have the diabetic retinopathy, don't lift heavy weights. So, and then this kind of gives some other options that they may have. So yoga, Pilates, Tai Chi, balance, other things they can do. And then down here, they can actually kind of set a goal for themselves. So how will I get started this week? And it has a line for them. So if that's something quick you wanted to do, that's an option there. Let's see, go back. And then there are some ones for kids. So being active as a teen, maybe it's sometimes adolescents, they get to a point where they're like, okay, I want to start going to the gym because, maybe their friends started going to the gym, or their friends have started encouraging them to join on. Like this kind of gives them a good place to start. Also, I guess tells them to share a selfie. Definitely trying to target that crowd. And then this is being active with your young child. So this is encouraging, just young children to become more active and what you could do to help them. So if you have a parent who has someone that's like, 0 to 2 seems a little aggressive, but 6 to 12, 3 to 5, and they're asking for advice, this kind of gives you some good advice. So, and it's all free. You just go in and click. I didn't go through any sort of like membership paywall or anything. So that was all of those I wanted to show. And then there is kind of the action guide, kind of how you could possibly integrate it into your practice. Here's the larger graph, or larger algorithm, sorry. And so it's all here. And I'm, here at UT, if you work at UT, I'm happy to see patients do exercise prescriptions. I've already done multiple, especially for Dr. Avery. That's a good place to integrate it. She's one of the obesity medicine doctors here. And so just as a part of that whole obesity medicine, seeing her, seeing a behavioral health consultant, seeing a dietitian, they see me and talk about physical activity promotion. So if you have that in your clinic, that's a good place to that you could refer to. So let's see. These are my references. This is some more promotional material from them. It was just kind of the best resource that was out there, so I used it heavily. But yeah, only prescription unlimited refill. So, and then I'll go to questions. I see a bunch of stuff in the chat, so I don't know if these are or not. Nope. Okay.
I was gonna say, I did post in there the link to the website you were sharing as a resource there, so if anybody needs that. And then I do see Dr. Ramos did have to step off, but she did want to let you know that it was a great presentation and that her NIH colleagues, and she had just published a study examining disparities in physician recommendations for exercise. So she thought that this was a very timely topic.
Yeah, thank you. All right. So let me see, Dr. Hayek, the question. Benefit greatly. What if the patients don't have? So when I have the fibromyalgia patient that doesn't have access to a pool, basically the most important thing with them is to start slow. Then the pool kind of allows them to kind of progress faster because it does tend to decrease their pain. But then I just counsel on going very, very slow. And a lot of times fibromyalgia patients are going kind of from zero activity to wanting to integrate it. And so, I'll start with maybe 1 or 2 times a week for only 15 minutes. And maybe we'll start with just walking, or we'll start with, basic weight training, just little, like small dumbbells, 2-pound dumbbells, doing some upper body. If we do lower body, it would be just body weight exercises. So those are things. Exercises for, hold on. There's a question before that. Dr. Baginski, do you regularly I do tell them I like to see them in 4 weeks. I feel like that kind of helps hold people accountable. If they know that they're going to have a follow-up with me and I'm going to ask where we're at on our goal that we set at the last visit. So I think regular follow-up is definitely important. You just give an exercise prescription, send them away. They may, not start any of it. And then they may never do it. Like if they don't come back and see you, no one may follow up on it. So, and then, okay, so then there was a second question, but yeah, no, usually I tell them they have to see me in 4 weeks. So, and then specific exercises for the pool. So depending on what sort of resources they're able to have, if they just have a pool, then just swimming is a good start. I assume if they're getting in the pool, they know how to swim. And then if not, or if they want to do something a little more, there are water aerobic classes, usually at most gyms or YMCAs. Or they could kind of just get they're kind of just like little foam weights that people use. And if they're underwater, they're heavier than if they're above water, obviously. So they could get those and integrate that sort of routine in. So those are the typical things. And then let me see. Some of my patients talk about as seen on TV equipment, like under the desk mini bikes. Do you find those useful or valuable? So, so I do actually, one of the people that presented during the big national conference, she presented the entire time from a walking treadmill, or she has like a desk with a treadmill under it. And she did encourage things like that's a little bit more expensive, but she did encourage things like the under the desk mini bikes, because then those are things patients can do during their typical workday. It's not such taxing activity, but it is a good starting point. And then some activity is definitely better than none. With Jerry patients, yeah, you want to be careful with falls, and there is a website, I think it's eldergym.com or .org here. I'll look real fast. And it actually is has all sorts of exercises targeted for the geriatric population, and it has how to do it. It has pictures of how to do it, and then under that, it has a link to a YouTube video of how to do it. So, and it goes over lower extremity, upper extremity, balance, posture, all those things. Yeah, eldergym.com. So, there's another one. Oh, just a thank you. Okay, let me put this one too. Let's see. So that's that. Any more questions? Pre-participation examination had 0 questions, so this is great. Right, silent. This is also a fast presentation. Oh, any recommendations for apps? So I don't know on the free apps. I definitely have to look into that. If you do have a patient that's willing to have like a monthly membership, Peloton, which is a bicycle, actually has a really good app, and it has all sorts of exercises. It's not just for the bicycle. It has upper body, lower body workouts, and then you can literally go on and click which equipment you have, whether it's resistance bands, dumbbells, and then it'll filter it by that. And I think it's about like $12 a month. So, and so I just feel like a lot of people don't know that's there because Peloton markets their treadmill and their bike so much, but they do have a whole separate exercise program that you can access just through their app. Fitbit versus Apple Watch. So I don't know that I have a preference there. So I think probably dependent on the patient's activity level. I think a casual person does well with an Apple Watch. I think the more physically active people, a Fitbit. I mean, this is definitely more technology oriented, but Fitbits stay charged longer, and they can be smaller. And so I know that people that are more physically active tend to prefer those, or the Garmin's. If they're runners, they like the Garmin watches a lot because they'll track their running route and all that. Apple Watch, I think, is probably good for your like casual athlete. And also there is an Apple Fitness thing now, so it integrates with TV, with your Apple TV, Apple Watch, but obviously you have to be like a very Apple heavy person to basically get that. And then Dr. Hepburn said that Classic Stretch is a great program on PBS for the geriatric patient. Just want to put that out there in case not everyone's reading the chat. And then Dr. Hyen, group challenges. Or family challenges. Yeah. So yeah, that's what I was assuming you were going for. So family challenges or workplace challenges are a great motivating factor for patients. So you could talk to them about that. Do you think other people at your workplace would be interested in increasing their physical activity? And maybe they could have a competition. I know when I was in residency at one point, there was a like a steps competition between the family health center and the OB/GYN clinic. So those things definitely do encourage people. People like challenges, especially if there's prizes at the end. Ultimate prize is better health, but it's not bad to encourage with maybe some other incentives. So. Oh, Dr. Hepburn also said classic stretch is on YouTube. So YouTube or PBS for anyone looking for geriatric patient stretches. Any other questions?
Well, with the absence of any other questions, we just want to tell you thank you, Dr. Svec, for your presentation today. We really appreciate it. And thank you for those who joined us today. If you need to reach out, please let us know. And I'll also be sending the evaluation link out again in an email if everybody could please just help us out with that. Thank you, everybody.
Thank you, everyone. Email me if you have any questions, or if you have my cell phone, you can text me. I know some of y'all do. So, all right, bye.